Greetings to everyone. My name is Eduardo Valdez. I am representing paper 58, which name is Classification and Enhancement of Invasive Ductal Carcinoma Samples using Convolutional Neural Networks. I am representing Instituto Politécnico Nacional and the Centro de Investigación en Computación. The contents of this presentation, first, I'm going to start with an introduction, our related work, the methodology, the obtained results, and the conclusions. Invasive ductal carcinoma, this subtype of breast cancer is the most common amongst all breast cancers. It takes 80% of the cases of breast cancer. In the following image, we have a sample of a breast with cancer. If you see letter A, these are the milk ducts. These milk ducts is where this type of cancer is most commonly presented. You can see letter B below the figure. You can see that cancerous cells are outside the duct. So to detect this type of cancer, we obtained a biopsy from the breast, and pathologists perform an analysis of this sample, and they determine if it's cancer or no cancer. The related work in which we are going to compare our proposal comes with Cyrez and his team. They present their work named Mitosis Detection in Breast Cancer Histology Images with Deep Neural Networks. Their proposal comes with a CNN to classify mitosis from histopathological samples. The next work is from Español and his colleague. Its name is Breast Cancer Histopatological Image Classification using Convolutional Neural Networks. They use a support vector machine to classify these carcinoma samples. The next work is from Araujo and his colleagues. Its name is Classification of Breast Cancer Histology Images using Convolutional Neural Networks. They use a CNN to classify these samples in 4 classes that are normal tissue, benign lesion, carcinoma in situ, and invasive carcinoma. Last work is proposed by Cruz Roa and his colleagues. Its name is Accurate and Reproducible Invasive Breast Cancer Detection in Whole Site Images, a deep learning approach for quantifying tumor extent. They use a CNN to classify carcinoma samples in YUV color space. The methodology. First, I'm going to describe the dataset that we used in our proposal. This dataset was obtained from a Kaggle contest. It is composed of 162 images from patient cells or tissues obtained from a tumor. This is the whole size of the full sample. It is about around 73,000 per 62,000 pixels, and it is divided in sub-images with spatial dimensions of 50 per 50 pixels, and the total number of sub-images is around 217 sub-images. 62,000 images were labeled as cancerous, and 154 were labeled as non-cancer. To improve the visualization and the contrast of the images obtained from the dataset, we used the sharp masking method, in which IP represents the values of picture elements in the processed image. IO represents the actual pixel values in the original image. A is a weighting factor greater than 1. It's randomly selected. And IM is the blurred or masked version of the original image. Additionally, we used histogram stretching in order to enhance the visualization of the images, in which F denotes the value of each pixel luminance in the original image, and GX are the new pixel values in the enhanced image. Fmax and Fmin denotes the original maximum and the minimum intensity grayscale values on the image. Here in this slide, we present the preprocessing results. In column A, we present the original RGB image. In letter B, we present a version with enhanced contrast of the RGB image. In letter C, in column C, we present histogram stretching of letter A, or the original RGB image. In letter D, we use both preprocessing methods to obtain even a better representation of the original RGB image. And on letter D, we present a mirror image of D, in which we use this mirror image to increase the number of images to perform the training of the neural network. The neural network that we used is the AlexNet model presented by Krichevsky. This CNN model comes with two stages. The first one is the feature extraction stage, in which we extract features from the RGB image. And the classification stage, this is the final stage of the CNN, in which we obtain two classes if the image contains cancer or not cancer. Finally, I'm going to show you the results of our proposal. First, we use around 54,000 of images for testing, and we performed 5 experiments. The first one consists in training the CNN with the original RGB image. The second one consists in training the CNN with the image obtained from the unsharp masking method. The third one consists in applying histogram stretching from the images. The fourth one consists in applying unsharp masking and histogram stretching to the RGB images, and with the resulting image, we trained the neural network. Finally, we perform data augmentation on the previous experiment, and we trained again the neural network with this new number of sub-images, and we obtained the results with this methodology. Here in the table, you can see that the confusion matrices, in which we demonstrate that we obtain the best results as we decrease the false negatives and false positives. And these are the worst values. And the best values are the true positives and the true negatives. Additionally, we used these metrics, accuracy, precision, recall, F1, and area under the curve, in which we can see in the table that the results were obtained with the data augmentation methodology. Finally, comparing our work with the state of the art, we can observe that we obtain nearby values with Cruz Roa, the author of the dataset, and we obtain better results than Cyrez, Español, and Araujo. A final experiment, we used a full sample classification of 24 patients. In this table, you can observe first in the target classification are the real values of this full sample. For example, patient 1 contains 42% of sub-images with no cancer and 57% with sub-images containing cancer. So the best results were obtained with the RGB-DI or the augmented dataset, in which we obtain close values of the target classification. In all of them, we obtained good results, but the best methodology was obtained with the data augmentation. In the last row, you can observe the cases with close values to the real one. And we can observe that also combining the histogram stretching and the unsharp masking methods without the data augmentation, we obtain also good results. The conclusions and future work, we presented a methodology in which we classified breast cancer through sub-images taken from high-resolution histopathological samples. We showed that histogram stretching and contrast enhancement can highlight details in the subsamples that are useful to the CNN. Data augmentation also leads to better performance as we increment variations of the original dataset. On the other hand, we also obtained what percentage of the complete sample is contaminated with cancer using the classification results. As future work, we propose to modify the hyperparameters of the CNN model and perform an analysis of which of the sub-images will be useful to perform the classification. For my presentation, thanks for your attention. If you want to contact us, here we have our emails. And again, thanks for your attention.